Okay, so this is the latest, yes? 68.5 million displaced. Just a few weeks ago, I didn't have this slide, okay? Now I do. 25.4 million refugees, yeah, etc., etc. 40 million internally displaced people, and 57% of refugees worldwide come from 3 countries, South Sudan, Afghanistan, and Syria. Surprise, surprise, yeah? No, it's not a surprise, yes? Then there are 10 million stateless people. Yep, and look at this number here. 102,800 refugees settled by the end of 2017. These are data from UNHCR at the end of 2017, December 31st, 2017. Yeah? 44,000 people a day are forced to flee their homes because of conflict and persecution. And UNHCR has got 11,517 staff, or so they say, working in 128 countries. Yeah? And that's them, yeah? Not Mercy Malaysia, them. We are funded almost entirely by voluntary contributions, which I will contest, yes? With 87% from governments and the European Union and 10% from private donors. Next, please. Now, the situation had changed from December 31st, 2016, when we had 65.6 million forcibly displaced people worldwide. Yeah? And this was at the end of 2016. 17.2 million of whom came under UNHCR's mandate, including 5.3 million Palestinians registered by UNRWA. Can we go back to the previous slide, Sonia? Yes, thank you very much. So, 68.5 million from 65.6 million happened within just the space of a year. We are approaching December 31st, 2018. We will try and see what the numbers will be when they publish it next year, probably sometime in March. Next, please. And next. And so, the health objective, because this is the Humanitarian Health Symposium of UNHCR, is to ensure that all refugees are able to fulfill their rights of access to essential healthcare services, and mark the very important and pertinent statement there: HIV prevention, protection and treatment, reproductive health services, water, sanitation and hygiene services. So it's not just about emergency health as we traditionally understand it. Next, please. And these are their global objectives in blue, and those are some examples of what they do practically on the ground. Yeah? So improve childhood survival, health education, access to primary care clinics, monitoring access in MCH, maternal child health clinics, facilitate access to integrated prevention and control of non-communicable disease, including mental health services, coordinating mental health services, support to primary care clinics. These are some of the activities. Next, please. I still can't get this. Oops, previous one. Yes, so IOM, the other player. Up till 2016, of course, IOM was the other player. It wasn't within the UN family. Very confusing IOM then was, yes? It was a very confused entity and a very confusing entity as well, yes? It was UN and not UN. However, that's been clarified now. They are part of the, you see it? IOM, UN migration, yes. So since end of 2016, that's who IOM are. And so that's their vision. Those are their mission statements: ensure the right to health for migrants, avoid disparities in health status and access to health services. Yeah? Oops, now it's working. Okay. Go back, Sonia? Although I can't make it go back. Yes. Oh, oops, I did. Okay. Right. And reduce excess mortality and morbidity among migrant populations, minimize the negative health outcomes of migrants. Now, who are migrants, ladies and gentlemen? Well, they are people who move from one place to another, people who migrate. Yes? The problem with that word migrant, though, is that it doesn't really specify who they really are, especially in terms of the humanitarian sector. Next, please. Because I don't want to confuse people again. Okay, right. So the IOM Migration Health Division programmatic areas has got 3 areas, basically. Yeah? One is for migration health assessment and travel health insurance for people who are resettling. 2 is health promotion and assistance for migrants, including labor and irregular migrants. Yeah? And especially in natural disasters. Now, mark this again. Especially in natural disasters, IOM assists crisis-affected populations, governments and host communities to strengthen and re-establish primary healthcare systems. Now, you wouldn't have seen this as part of IOM's mandate perhaps 5 or even 3-4 years ago, yeah, before the World Humanitarian Summit. Next, please. And ladies and gentlemen, this is a graphic presentation of those refugees at the end of 2016. Of course, this does not include the large number of people in Cox's Bazar, which occurred in 2017, but they were already there. Yeah, the dot here in red. Yeah. And next, these are the internally displaced people at the end of 2016. Yeah, especially in Syria, especially in Sudan, both north and south, in the DRC, and of course the growing problem in South America, both in South and Central America, due to another kind of problem, narcotic wars, narco trafficking, etc., etc. Next, please. And of course, the facts and figures also show, however, that there is displacement caused by disasters, yes? And the blue dots are the ones caused by disasters. And you can see that there is a huge difference between what's happening in disasters. Can we go to the previous slide, Sonia? To the one that's occurring in conflicts, yes? And the previous slide, Sonia? And this one, yes. And Southeast Asia, where conflicts are concerned, don't matter very much, yes? But 2 slides further, Sonia? As well as in internally displaced people, up to that point. But look at the displacement caused by disasters, yeah? That's how it is, yes? So next slide, please, Sonia. Right, and of course, if you believe in a creator, in a divine force, he has somehow planned it that it all happens, in this part of the world, yes? Or rather worse, in this part of the world, and very little in countries which are fully developed and very rich. And so you have the environmental burden of disease globally already affecting the global south, the developing world, much more than the global north and the developed world. And then previous slide, Sonia? And then you have all this happening, yes? In the same parts of the world. So next slide, Sonia. And the next one. Thank you very much. So are the traditional assumptions still relevant? There are now more categories of people who are forcibly displaced. They are now displaced longer. The conflicts in DRC, in the Central African Republic, in Sudan, in South Sudan, and now in Syria and Afghanistan have not abated. Yes, ladies and gentlemen? And they are now displaced longer, therefore. Conflicts last longer. And natural disasters, oops, I didn't do that. Go back, Sonia. Natural disasters are now more frequent and more severe. Now, the only good thing, I guess, is that there's more preparedness towards natural disasters, which has limited somewhat the casualties from these more severe and more frequent natural disasters. Climate change-related displacement are more in numbers and in diversity. And here, I would put it to you, climate change, yes, diversity, while we talk about the burden of disease in the developing world, yes, there is a town called Perdaus at the moment, which is no longer paradise. You know where that is? In Northern California, yeah? It's been decimated by forest fire, yes? So that's a developed world catastrophe, yes, caused by an overwhelming forest fire. Phil here, I know, is a firefighter himself, yes. Or rather, yes, previous firefighter. So, and he can tell you that it's not the easiest thing in the world, yes, to face a forest fire. And you've had your share in Australia, yeah? And who knows, yeah? Hopefully not as bad as the ones we are seeing in the US at the moment, but, an entire town in the world's, let's see now, I think California is the world's 7th or 9th biggest economy, yeah? If you take it alone, yes? Happening in the world's 7th or 9th biggest economy, yeah? Not in Indonesia, not in Nigeria, but in California, yes? So next, please. So, this working definition or conceptualization. So this is from IOM, back 11 years ago, yes? That there was already a terminology called environmental migrants. Persons or groups of persons who, for compelling reasons of sudden or progressive change in the environment, like in Paradise, yes, that adversely affects their lives or living conditions, are obliged to leave their habitual homes, or choose to do so, either temporarily or permanently, and who move either within their country or abroad. So now you have IDPs in California, ladies and gentlemen. Yes? Next, please. So, the IOM experience with that is a bit more varied, of course, yeah? And this refers to the South Pacific as well, the rising sea levels, yeah? Affecting the Indian Ocean as well as the Pacific, yeah? So you have Mauritius, Maldives, Madagascar in the Indian Ocean. You do have the Pacific Islands, of course. And then you have drought and water scarcity and conflicts, which sometimes are climate change driven, although they are not usually looked at it that way. They're always looked at from a sectarian perspective, from a religious perspective, from a tribal perspective, but we forget that sometimes it's all because people are competing for natural resources which are now no longer available, yes? So, vulnerability mapping for durable solutions to displacement is key. Next, Sonia. Yes, oops. Somehow when you do it, it works. And now, why is it important? Because the UN Declaration on Human Rights, Article 25.1, everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, etc., etc., etc. Unemployment, sickness, disability, widowhood, old age, all of those are related to health, yes? Next. And therefore, there are also new challenges for refugees these days, yeah? There are psychiatric disorders precipitated by the refugee experience, yes? Especially if there's no hope, or especially if you go from a situation which is bad to a situation which is even worse than bad, yes? And that's happening in many places now, yes? In Cox's Bazar, for example. And now suddenly, you find that the two countries, both the host country, Bangladesh, and the country of origin, Myanmar, which has never been friendly to them, are now talking about forcibly repatriating them, yes? So, you know, there's already a certain amount of stress already by moving, and now there's added stress of having to be moved back again, yeah, forcibly. There's also infectious and parasitic diseases endemic to countries of origin. In Africa, if you remember the map just now, yeah, people move from one country to another, sometimes from one region where there is no sleeping sickness caused by the tsetse fly to a region which there is sleeping sickness, yes? From a region where schistosomiasis is not prevalent to a region where it is, yes? So this causes huge problems. And chronic diseases are endemic to host countries. Now, tuberculosis is, of course, a situation, or rather a disease, which comes to mind, yeah? So these challenges faced in stages by refugees themselves and by the array of health and social service agencies committed to providing refugee assistance, including some of us here. Next, please. Yes. So, a human rights-based approach to emergency response is probably needed and has been spoken about, and I think most of us will agree with this. This is from UNFPA, which promotes participation and inclusion and strengthens both government and UN accountability to affected populations. Responding in a non-discriminatory manner, this is key, non-discriminatory, yeah, to reduce disproportionate impact of emergencies on most vulnerable subpopulations, including migrants. Why? Because you have situations like this. This is in Malaysia, yeah, where access to public healthcare, to government healthcare facilities, is available only for UNHCR document holders, which, by the way, only account for about 30% of the total number of refugees we have, yeah, but they come, even then, they come at a very high cost. And refugees in Malaysia, by the way, at this moment in time, because Malaysia is yet to sign the 51 and 61 conventions, or the 67 protocol of the 51 convention, refugees in Malaysia at the moment do not have the right to work, yeah? Therefore, further compounding the situation. Next, please, Sonia. So, however, with that in mind, is there perhaps a role for new actors or new roles for old actors, which then can mitigate and make these problems go away? Yeah? Well, there definitely might be a discussion, the need to discuss this today. Yeah? Governments come into mind, of course. Oops, how did that happen? Nope, go back, please. Government agencies, not usually associated with displaced people. So you have people in the Environment Agency, for example, Environment Protection Agencies, people in the military, yeah? Of course, the US military, the Australian military, the Allied military, let's put it that way, have now got experience in delivering humanitarian aid in countries of conflict. But more and more now, yes, the US military will come in direct contact with refugees and migrants, yes? Why? Because, well, POTUS has decided that the US military now will be dispatched, yeah, in large numbers to the US border, yeah? And of course, people in the US military now have to contend with people who are displaced in Iraq, in Afghanistan, etc. But now they're coming face to face with migrants coming across South and Central America, right up to the southern border of the US. Yes? The private sector, the role that the private sector needs to play. Private sector already is responsible for some economic migration. Yeah? Indonesians move to Malaysia, to Singapore, to Thailand for work. Yes? However, and I'm sure people from the Pacific do the same to Australia and New Zealand. yeah, and therefore then increasing the number of South Pacific Islanders, of course, contributing to both your rugby league and rugby union teams as well, yes. However, that aside, yes, they also come with all the problems of their home countries, yeah. And when they come here, they face other problems, yeah. And financiers, philanthropists, well, that's a spelling error there, philanthropists, yes, will play an increasingly important role in the years to come. And of course, insurance and reinsurance issuers. Next, please. The military, for example, already giving help to medical support to international humanitarian assistance and disaster response. Well, now they will have to do more in terms of medical assistance to migrants and refugee populations as well as IDP populations. It is no longer a question of if, but a question of when, including for the Australian military, I believe. Next. Technology, humanitarian action and forced displacement. We all need to embrace technology. Drones and unmanned vehicles and their utilization is already functional. Ladies and gentlemen, we all know this, yes? People are dropping nutrition supplies by unmanned aerial vehicles. Drones are used for mapping, etc. Artificial intelligence and their holistic utilization in forced displacement. This is still to come, yes? And we need to have more focus of technology on forced displacement. Geospatial technology, for example, is already in use, and this is particularly useful in climate change forced migration. Next, please. And humanitarian technology, this is from the Refugee Crisis Group. Yeah? We need to invite subject matter experts from civil society, government. Go back. Exchange of views, discuss current gaps, as well as share experiences about the use of humanitarian technology. So you have fintech, financial technology, now you have humtech, yes? Humanitarian technology, get used to that term, okay? Especially in the field. And showcase existing emerging technologies to improve disaster response. This is already happening. We need, however, to bring, previous slide please, to the focus, bring the focus more and more on forced displacement, because this will be the biggest challenge going forward. Next, Sonia. Thank you. Yes. Now, how the health sector works in forced displacement? Is it still relevant then? How to do better? Are we working together? Is it already a culture? And humanitarian health actors and their optimization and the interaction between international, national, and local. In Cox's Bazar, this is a very good example, Cox's Bazar, the theatre that is, of interaction between international, national, and local. However, we still have an issue with national trying to say that they can deliver, yes, and internationals saying that yes, you can, but there are gaps which you need us for. And of course, there are local actors who say to both international and national, why don't you both go away and leave everything to us, yes? However, we all know that that's not possible most of the time, yes? And even the Bangladeshi national authorities acknowledge this. Next, please. And so from that perspective, we look at the functions of the health cluster. All that, yes? All that. I won't go through them one by one. However, let's look at number 7, which is training and capacity building, including emergency preparedness. Let's look at number 10, provider of last resort. This is still, these two items are still not there in terms of the functions of the health cluster at country level. This is something which we may want to look at in the near future. Next, please. And so, working in partnership within the health cluster is necessary, I believe, and an effective partnership should be inclusive, complements and strengthens existing coordination structures and processes at both national and subnational level. The problem is, of course, when we go to subnational level, and this came from the Global Health Cluster, yeah? Oops, what's that? It's not me, okay. That's Sonia, okay. The problem when we talk about this at the subnational level, you have to click yes or no. 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 Do not update now. You need to move here. Yes. Yes. The problem of bringing it to subnational level, of course, is that the combination of both local actors as well as the host community is usually sometimes not easily not easily, oops, nope, didn't do that, oops, okay, not easily educated, yeah? Simply because international actors like ourselves, like most of us here, do not understand the pre-existing conditions and the pre-existing problems which they have. Now, the way to do it, usually, is to engage the local community and the local health actors and the local humanitarian actors and see what they need first. So the Malaysian government, for the moment at least, since late last year, has had a Malaysian field hospital there in Cox's Bazar, initially funded by the Malaysian government, now funded by two not-so-savory Middle Eastern countries, you know, not so savory now, yeah. Saudi Arabia and United Arab Emirates, yeah, although they're very rich, and still funded by them. Now, the Malaysian field hospital has gone from having 70% of its patients being Rohingya to now only about 30 to 40%. The other 70% now are local Bangladeshis. Now, that may be a bad thing, you say, yes? However, if they want to continue to work, they will probably have to find a balance between serving both communities. So next, please. Start with realistic and objective goals, achievable objectives, sorry. Ensure all partners have something to gain. There, I've just said it, yes? I didn't say it, it was the Global Health Cluster, yes. And listen to other partners and learn from the past. Ensure transparency in all cluster activities. That's easier said than done, of course, yes? Because sometimes, how do we manage a situation where you need to give immunization, for example, in a situation where the host population is adamantly against the very concept and principle of vaccination. Next. And so in Mercy Malaysia ourselves, being a small but rather impactful organization which prioritizes humanitarian health, we have all that in our menu, yeah? But we also found that we've had to move away from doing more emergency response to doing the rest, especially in reproductive health and public health, as well as mental health, including for forced displaced communities. Next, please. And an example of which is in Cox's Bazar at the moment, where we've set up maternal and child healthcare centers. We've set up one, operated in it, and now handed it over to the Bangladeshis. We are setting up another one with a different Bangladeshi partner now, hopefully to be ready by the end of the year and to be functional by early next year. Next, please. And public health comes very much into play here. So this is from Oxfam, and Oxfam does a lot of things, of course, and does a lot of things very well. And one of the things they do well is communicating and informing on what they do. And the importance of hand washing, how to keep water clean, how to dispose of human waste. And of course, a lot of training as well is done. And vector control and malaria prevention activities are just examples of the kind of activities humanitarian health workers will need to do more and more of with forced displaced populations. Next, please. And again, in our projects in Cox's Bazar, Mercy Malaysia has found that doing health in its traditional way alone is not adequate. We need to do WASH as well. And WASH definitely works together when it, or rather works better when it's done together with health in coordination. Yes? Next, please. And with that, there are also, from Oxfam, some interesting innovations on how to communicate better with communities and some interesting partnership models. Yeah? So, you know, using radio and songs, using street theaters, using puppet shows, etc. These are mostly in situations where there's no longer an emergency, of course, but it can be modified. Yeah? And development of interactive e-learning modules, yeah? Education and communication in WASH emergencies, and partnership with universities, one of which is Monash, right here in Melbourne. Yeah? And other universities in the UK and Spain are given as their partners at the moment. Next, please. So partnership, ladies and gentlemen, is how we do it. So the other issue is, of course, financing humanitarian health in displacement. How, by whom, for what, and for who? Not WHO, that's why I purposely made it small letters, yes, for who, yes. And do the usual mechanisms work anymore, yes? It's a whole lecture by itself. I don't have time today, yeah? But we all know that the global humanitarian funding is grossly underfunded, yes? Every year since 2013 now, the global humanitarian appeal, the GHA by the UN system, is underfunded by at least 30%, yes? And therefore we need innovation in the way we finance humanitarian health in forced displacement, especially if we think about forced displacement as not only involving those who are forcibly displaced by conflict, but also by disasters and by climate change. Next. And so, one possible innovation is bringing an investors group together. Yeah? So this is an example of one investor group, the GFF investor group, which includes foundations like the Global Fund, which is partly funded, of course, through philanthropic money, yeah? The Bill and Melinda Gates Foundation, but of course also governments like Canada, very sexy and very nice government, yes, Canada, yes, and of course a more stern but very accountable and responsible aid agency like JICA from Japan, yes, but also including countries from Africa here, yeah, and the UN system, yeah, and also, of course, the World Bank, yes, getting more and more important, the World Bank Group, yes, and very much so in the humanitarian sector. They are now part of the Interagency Standing Committee, and of course NGOs like World Vision and I'm sure SAVE as well, etc. Next, please. So what next, ladies and gentlemen? What next? Well, can we go back, Sonia? I think we missed something. Yes. What next? Okay, never mind. What next then? So insanity is doing the same thing over and over again and expecting different results. Now, I didn't know that Albert Einstein was a Maori, but never mind, yes, with the tongue coming out, yes. However, he did say something very good here, yes, which is, doing the same thing over and over again, expecting different results is actually madness, yes. And so that's probably the most brilliant mind of the 20th century. We've yet to see one in the 21st, yes. So, next, please. So, in terms of roles and responsibilities, the Health Cluster Lead Agency, WHO, which acts as a bridge between national, local health authorities with international ones, ensuring health actors in turn response build on local capacities. Next. Ensure establishment of effective coordination mechanisms. Next. Mobilizes and deploys technical and human resource and stockpiles. However, there is one point here which says that the WHO, after doing all that, should act as the provider of last resort. Okay? This again didn't come from me. It came from the Global Health Cluster. Okay? Is this doable, ladies and gentlemen? Is this possible? I put it to you that this is a necessity going forward. Yes? Next, why? Next, please. Because of this, yes? Because of the assertion of state sovereignty, yes? How? In different ways, yeah? By Indonesia, by refusing access to international humanitarian organizations. Yeah? Sorry, Uni, yes, yes. And by whom? But also by the US, yes? By Donald Trump. For what? For different reasons, yes? For, like Indonesia and the Philippines, to show that their governments are not that weak in the face of natural disasters, but also by the current US administration to show that it wants to keep America's borders relatively functionally safe in their minds, in their views, yeah, from outsiders. Yeah? For who again? So the arguments are the same as in financing, yes? For who? Well, it depends on who you ask and who you talk to. Yeah? And are the usual mechanisms working? Well, the usual mechanisms perhaps are not working as usual. So the idea that in an emergency response to disaster and therefore the response to forced displacement as a result of natural disaster in Indonesia, the international NGOs and the international system can actually come and do its work as usual is not going to work anymore. Yeah? So for that, we need to innovate. And innovation here, as opposed to the financial innovation, will need to come in other ways of working, especially in partnerships. Next, please. Why? Because in Sulawesi, there are now about 230,000 people displaced. 230,000 people, okay? There are still about 100,000 people displaced in Lombok. Lombok had an earthquake. We've already forgotten about Lombok, okay, because it was smaller, yes? It only happened 4 weeks ago. In fact, I was in Lombok just a few days after the Sulawesi one happened, because we were handing over our shelters, Mercy Malaysia that is, to the Lombok authorities. And so it was a very surreal moment, yeah, where you had the Lombok people, while, you know, in Indonesian language, they had this big poster saying "Bangkit Lombok," you know, rise Lombok, yeah. But at the same time, they were also thinking about what's happening in Sulawesi, yeah. So it's It's not easy, yes? And so medical services through mobile clinics across Sulawesi, yeah? Is it still doable through international organizations? Perhaps not. Yeah, perhaps not. Next, please. So, but however, ladies and gentlemen, as you can see here, and I'm sorry about the size, this is the biggest I can go. In the space of just a few years, yes, you see the 5 top global risks in terms of likelihood and the 5 top global risks in terms of impact have already changed. In 2013, okay, number 1, yeah, was severe income disparity, yeah. 2014, oops, sorry. I need to go back. In 2014, it was income disparity. In 2015, it was interstate conflict with regional consequences. Why? Because people were worried that the Syrian war would become worse and will involve Iran, Saudi Arabia, Russia, blah, 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 and the US, of course, yes? The US actually still has a presence, of course, in eastern Syria. But it changed. In 2016, large-scale involuntary migration. This is official, yeah, from the Global Risk Report. And of course, in 2017, it changed again to extreme weather events, yeah? And in terms of impact, major systemic financial failure was in 2013, okay? Fiscal crisis was in 2014. Water crisis was in 2015, yes? Failure of climate change mitigation adaptation was in 2016. This was when, of course, everybody was worried whether Trump's US will actually adhere to the Paris protocols, yeah? And now, in 2017, it was back to weapons of mass destruction. I don't know how that happened, yes. But you have there in number 2, the extreme weather events, sorry. And number 3, water crisis. Number 4, major natural disasters. And number 5, failure of climate change mitigation and adaptation. So this is the situation we have at the moment. Next, please. With that, I put it to you that while conflicts remain pertinent and remain necessary for us to engage in and dispel and, if possible, prevent, yes. However, I put it to you that climate change and its consequences will be the biggest driver for migration in the years to come. Droughts and changing rainfall, rising sea levels and glacial retreat and desertification. You're seeing some of the desertification here in Australia as well. Future migration displacement from climate change, well, all that. Short-term climate change is already fueling displacement, yeah? 1.5 degrees Celsius of warming, moderate but manageable. 2 degrees, a new hostile reality. 3 degrees Celsius, catastrophic climate change, forcing people to flee. 4 degrees Celsius warming, ladies and gentlemen, we'll have a Hollywood movie situation, yes, upon us in the next decade or so. And I didn't say this. This was from CARE. Okay, so anyone from CARE here? Yes. So next, please. Next. And so you've heard about the humanitarian development peace building nexus. Well, you got another nexus here. Okay. Climate change, water migration nexus, CWM, not weapons of mass destruction. Okay. The C is climate, water is W, M is migration. By 2025, up to 2.4 billion people may be living in an area subjected to periods of intense water scarcity, by the way, including California, yeah? Which may displace as many as 700 million people by 2030. Okay? And yeah, by 2050, 162 million people in Bangladesh, Egypt, and China. Of course, this is not counting the fact that in Egypt, in that part of the Nile, people may go to war, ladies and gentlemen, in the next 10 to 20 years, yeah? Depending on what Ethiopia, Uganda, and Egypt does with the Nile, yes? Yes. And small island states will be vulnerable to sea level rise, another 50 million to desertification. Next, please. And so this are people leaving Aleppo at the end of 2016. Well, previous slide, Sonia. If that happens, next slide, Sonia. Sorry about that. This will look like a walk in the park, yes? And we'll be facing a situation 10 times this, yes? Next, please. And the Syrian, just to take it into context though, the Syrian refugee crisis is not just a refugee crisis because of the war, again. And so in Jordan, as we speak, and this came from Mercy Corps, yes? You have these figures, yeah? The fact that the population of Syrian refugees in Jordan now accounts for about 1/3 of the population of Jordan means that the water problem in Jordan is a lot worse, yes? And where then do these people go? if there's no more water in Jordan? By the way, which is related very, very strongly to the geopolitical situation in Israel and the occupied Palestinian territories, yeah? And should a conflict break out there again? Okay, so next, please. Therefore, ladies and gentlemen, the other issue, of course, is the new funding solutions, which I spoke about just now. Yeah, new funding solutions must include insurance and new financing instruments. Yeah, because giving money has its limits. Asking for money also has its limits. Yeah, insurance and reinsurance is the way to go. Bonds and sukuk, for those of you who are not as informed, sukuk is the Islamic version of bonds. Yeah, in Islamic social finance, that's a whole topic by itself. Public-private academia, civil society partnership, involvement of both host and displaced community, yeah, in funding solutions, yeah. Because one of the problems with insurance and reinsurance, of course, if we just give, for example, insurance to the incoming community, let's say in Jordan, yeah, what happens then to the host community, yeah, who are also deprived of, say, water supply? Next, please. And an example of which is already happening, examples of which are already happening. This is just a very small example in Malaysia, okay? In the middle income country that I come from, which has a 93-year-old as a prime minister, okay? Which tells you something, yes? The rest of us must be not as clever, yes? And so, so coverage for individuals, for families, you know, costs just that much, yeah? Et cetera, yeah? And which includes also personal accident insurance. These are for refugees who already have a UNHCR card in Malaysia, okay? So if this can happen in Malaysia, this is a bank in Malaysia. RHB Insurance actually is a company that is associated with a bank. It can happen anywhere else as well. So next, please. Because otherwise, we won't be able to fund all these. Yeah? People forget that there is still a crisis in South Sudan. There's still a crisis in the Central African Republic, and the Rohingya conflict is unlikely to go away anytime soon. So, you know, for Cox's Bazar, because of the longevity of the crisis, who's going to fund it next year? 2019. We're already coming to the end of 2018 now. I know because Mercy Malaysia ourselves are already finding it hard to look for funding for 2019 for Cox's Bazar. Yeah? That's just one example. Yes. So, ladies and gentlemen, with that, so again from Herr Einstein, yes. So he said, if I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about the solution. Well, I put it to you that on this one, I don't agree with Herr Einstein, okay? I think we should turn it around and spend 55 minutes thinking about the solutions. Because I think we all know, with regards to forced displacement and humanitarian health, what the problems are. And I think we only need 5 minutes or so. People like Uni and Phil probably need 3 minutes, yeah? Myself maybe 7.5, yes? And so, but we should spend 55 minutes thinking about solutions. With that, ladies and gentlemen, I hope I have somehow managed to set the tone, as they say, yes? And hope I've earned my breakfast and lunch. Thank you very much.